Well, again, good morning to everyone. Let's give a warm welcome to two very busy legislators, Assemblymember Rebecca Bauer-Kahan and Assemblymember Gail Pellerin. Welcome. And Senator Scott Wiener is on his way. As you said, he's at a budget hearing. This is, I remember, this is end of February. It's when the legislature begins really picking up, and we understand and makes us especially grateful that you are here, because we know you are busy. So, as I said earlier, and as Tara said a moment ago, 10 years ago, there weren't many legislators that were working on these sets of issues. And now, the zone, so to speak, is flooded. And yet, there are some who really take it on with even greater seriousness and purpose. And we're privileged to have two of the leaders who are doing just that. And there's Scott Wiener. This is, so having been in the both the Assembly and the Senate, I must say the senators always make grand entrances here. Hi, Scott. Hi. Please welcome Senator Scott Wiener as well. Okay. So, my first question actually is to Senator Wiener and Assemblymember Bauer-Kahan, and only because you two have been here the longest. Senator Wiener, you are now in your 9th year. Assemblymember, you are in your 7th year, correct? And Assemblymember Pellerin is in her 3rd year. So for the two on either ends, big picture, when you first got to the legislature and you thought about behavioral health, what was sort of the mindset of the body politic in terms of the priority of these issues, and what has changed over the course of your tenure?
Well, for me, I think it's a much bigger issue now in the legislature than it was, and in part because of your work, Mr. Mayor. And because I remember early on, you and I worked on a bill together, and I forget if it was 2017 or 18, to try to devote more resources from the Mental Health Services Act to the needs of young people. Because there was the emerging broad awareness that young people that's when mental health issues tend to manifest, and we were just completely just leaving them out in so many ways. I will also say that I started working back in 2018 on the first version of trying to deal with conservatorships, trying to modernize our conservatorship laws. Ultimately, Senator Eggman was able to carry the ball across the goal line, but we were able to sort of get that started. And I remember it was my first year when I was thinking about doing this work with the city of San Francisco to deal with the fact that we had people who were just unraveling and dying on our streets, and it was just unacceptable. And I remember my chief of staff saying, you'll never be able to pass a conservatorship bill. It's impossible in the California legislature. It'll never happen. And then every time we would have a vote on a conservatorship bill, this is starting in 2018, when we were supposedly not able to do this, it would be like a unanimous vote. In the committee, on the floor, not controversial, from far right to far left, just broad-based. And then we had a mayor's race in San Francisco where every single candidate opposed our conservatorship bill in 2018 except for one, and the one who supported it won the election. So I think the politics around mental health have just been swinging, where people deeply understand that it's real, that we have to do a lot of different things to try to address it, and so it has been a transition for sure.
Yeah, I want to start by saying how amazing the Steinberg Institute is, and Tara, who we just heard from, who's been an incredible partner on this.
Yes.
And I want to echo that I think the advocacy that you have brought to this space is really critical. When I joined 7 years ago, I would say, and I'm probably going to offend some of my colleagues, the Assembly had one champion, then Assemblymember Eggman. And it was not an issue that was front of mind for folks. People supported her work, but it wasn't something a lot of people were thinking about or working on. And to be perfectly honest, I didn't run for office thinking I was going to work on behavioral health or mental health. It wasn't an issue that was really front of mind for me. And it was really being in the community and listening and living with now teenagers that has shaped my work in this space. And I think that reflects what is happening in society. I think we've seen the stigma really shift. I think we've seen the administration also. I mean, I see Stephanie Welch over there, Dr. Ghali and Stephanie, and the administration has really leaned into behavioral health in a way that I would say when I joined the legislature 7 years ago wasn't, I think, as present in the conversations at the executive branch either.
Unprecedented.
Yeah. And so, there's been a real shift. And I think what's interesting is when the first time I interacted with the Steinberg Institute was when they came to lobby me, Tara may remember this, on Scott's bill, that was going to force private payers to pay. And as I tend to do, I hijacked the meeting. I was like, yeah, I'm going to vote for his bill, don't worry, but let's talk about this other thing I'm thinking about. And that led to our work together on AB 988. And, when I started that bill, we were in the biggest budget surplus in California history, and I was introducing a fee bill. There wasn't one person who said to me that was possible. But the Steinberg Institute and I decided it was possible. And what made it possible was I sat down with every single one of my colleagues, one-on-one, and I talked to them about it. And there wasn't one of the 119 people that I serve with who didn't have a story. And they hadn't talked about it. And when I presented the bill for the last time in concurrence, my seatmate at the time started crying. And he was sobbing next to me. And when I finished and I put my mic down, he said, my cousin died last week by suicide. And he hugged me. And it was that. It's the stories. It's the personal piece that we've kept in the shadows that we are now bringing out of the shadows that is changing the conversation. It is changing the ability to do this work. And it is bringing more champions like Assemblymember Pellerin to the table.
Assemblymember Pellerin, you've been in the legislature now. This is your third year. And you've been very public about your own personal tragedy. Has that affected your motivation and your willingness to want to champion this cause?
100%, yes. So mental health has profoundly impacted my family. Both my kids have struggled with mental health over the years, and I have struggled to navigate the system. But it was very quiet. We didn't want to tell anybody else that our kids were going through some mental health crises. And there was a stigma around it. I myself, when I went into counseling, a friend of mine told me, do private pay, don't put it through your insurance. You don't want anyone to know, because I was an elected county official, that I was going in for counseling. And it didn't make sense to me, but and I didn't follow her advice, but I had it private pay anyway because that was the reality of the situation. But it was in November 19th of 2018 that my husband died by suicide. And wow, thank you. It just really changed my perspective so much. And there was so much about suicide I did not know. And I set out to learn about it. I set out to understand what would cause somebody to take their own life, to make that last and final decision, to not want to be here to see his kids graduate from college, or my daughter's getting married in 2026, those great milestones. So I put my grief to work. I learned about suicide. I learned it wasn't a selfish act. I learned it was something that happens to somebody when they're in a very hopeless state. They just can't go on. They're in such dire pain. They see no other options. They're not well. And so I started speaking out about it. I went to my county board of supervisors and presented asked them to do a proclamation for Suicide Prevention Awareness Month. We did the overnight walk in San Francisco where we walked over 16 miles from 7 p.m. to 7 a.m. Those are hours I prefer to sleep. And but we were like the second largest fundraiser for that event. And I'm going to cry again. But it was the first time my kids were able to admit that their dad died by suicide. And that was in June, after he had died in November, because they couldn't say to their friends that their dad took his own life. My daughter actually said he died of a heart attack, which is kind of true because he had a broken heart. But no, he took his own life in our home, and thank God nobody was there. But it motivated me to speak out, and so we did the walk, and then we were looking for somebody. We had never elected a woman from Santa Cruz County to any office higher than countywide, so we set out to change that. And anyway, it ended up being me, so I am here. and I ran because I also wanted to put a face and a voice to mental health awareness, to remove the stigma. And one of the first things I did when actually I did this in the county too, we asked to have the 988, we didn't have 988 then, but get a suicide prevention hotline number posted in all the restrooms. I then advocated for that to happen in our swing space in our capitals, so there's a 988 poster in all the restrooms, and thank you to, I'm here among legends here in this work, and I'm just so honored and humbled to be sitting here among all of you, and I'm just going to do my damn best to do everything possible to make sure every single person in this state who needs and deserves quality, accessible mental health care will get it.
And you, thank you. And you have 10 years left on your term limit. So you're at the very beginning, and I hate to say, it does go fast. It does. So each of you have legislated in different ways to improve this system. Becca, you obviously the 988 bill, which was not easy because it involved a fee. You're exactly right. With the telecom industry, which is a big power in this state, and they don't like fees. And you stuck with that. Senator Wiener, among many things, you took on the issue of parity, which is another difficult issue. And Assemblymember Pellerin, you just starting, but among other things, you also authored the bill to make sure there's more accountability, especially around mental health and for children in the child welfare system. I want to ask you, so the role of a legislator, I know, is different than a member of the executive branch. And you know, I will say it a million times how appreciative we are of Governor Newsom and his team's leadership in this space, but here's a fact. He's only here for another 20 months. So I want to talk a little bit about the role of the legislature in system improvement. And want to make another observation, and then I'll turn it over to you for your comments. And that is, and this is not an ideological statement, it's just a fact. We spend a lot of time in the legislature and in society talking about conservatorship and about the individual's responsibility to accept help when it is offered. Fine, you're right. The pendulum is swung. These are relevant, important things. Nobody should be out on the streets under any circumstance. Fine. But what are we doing about system improvement itself in terms of the delivery of the services to make sure that people actually have access to the care? Because you can't turn it down unless you're offered it in a genuine way in the first place. Outcome-based data, requirements, incentives. Is the legislature as a body capable, given the numbers of people and the huge amount of stuff incoming on fires and budgets and everything else, to actually tackle systems reform?
You know, it's hard, but I think we Yeah, I think we can if we're willing to really put our minds to it. And I've, as you've noted, I've focused intensively in recent years on the health plans, and I think when we look at with health insurance, which historically has just been atrocious in covering behavioral health, right? It's cover you if at all. If at all, then it's going to be brief. It's maybe only going to be when you're in crisis, and then only as long as you are technically in crisis. No early intervention, no ongoing. In fact, the reimbursement rates are so atrocious that we all know that there are so many mental health professionals that simply don't take insurance. So it's a system designed to fail, and it's reflective of the broader societal stigma about if you have a behavioral health problem or if you're addicted, it's a personal failure. Just buck up, be stronger, have better willpower, get it together. That's historically society's approach to behavioral health, and that's reflected in the insurance industry. So we have been battling to get that to change, and so SB 855, which Steinberg Institute helped put together and co-sponsored, that was a huge step. And that bill, which was a war with the insurance industry, passed overwhelmingly in both houses. It was controversial in the legislature.
What did it do?
SB 855 was our mental health parity law in California, to say that we had a parity law in the books for a long time. It had all sorts of loopholes in it. It was not strong enough, and so we made it the strongest mental health parity law in the country. Now we are working to make sure that it's actually being enforced, and I will say that we just had a budget committee hearing on this. The Department of Managed Healthcare has been doing more to enforce. They came down hard on Kaiser a few years ago, but it's not been consistent enough. And the health plans, we know, still, I think, have this, they sort of know that there's not going to be a lot of enforcement. And I'll tell you, we have a bill now to try to really drop the hammer, because what we see, and in the last few years, we've been working on the independent medical review space. So if you get denied, as you probably know, you have a grievance procedure, and then you can seek an independent medical review. And when most people don't know that they can seek an IMR, or they don't have the resources or time or wherewithal to actually do it. People who are not English speakers particularly don't do it. And so, but we know that for the people who do seek IMRs, overwhelmingly, those denials are overturned. Overwhelmingly, they're overturned. And that is an indictment of the entire system. And that's why we tried for a few years to trigger automatic IMRs when young people's mental health treatment coverage is denied. We have a bill this year right now, SB 363, in addition to providing broad data about health plan denials, really lifting up the hood, putting massive fines on the health plans if more than 50% of their IMRs or denials are being overturned on IMRs. So we're trying really hard, but we have to have much stronger, more consistent enforcement by the Department of Managed Healthcare, and real consequences for the health plans, not just cost of doing business. And I'm sorry, just one last thing. On that bill, it's been really fascinating. People are coming up to me on the street on that bill saying, I want to tell you about my horror story. But a woman came up to me the other day. There's an organized group of moms in San Francisco and in the Bay Area whose kids are addicted and on the streets or dying on the streets. They're super, super organized. And they now have come to me and talked about so many of these kids, young people, who are now either dead or on the streets disappearing due to addiction. It started with a health insurance denial for addiction treatment. That's how it started, and now it's spiraled all the way to homelessness and death.
So I mean, I think to answer your question, two things. One is we need more legislators like Senator Wiener, who, I say this with all the love in my heart for Scott, is a total nerd. He cares deeply about his bills, and he cares what happens after they pass, right? And that's what you're hearing him talk about. I brought that up at our Assembly caucus retreat we just had because, I actually think we are in a lot of ways incredibly well poised to deal with system reform. AB 988 in my world started with a mom who showed up to a walk and talk in my district the system had failed her. And I sat down with her and I asked her to tell me her story. And she told me her story. And what she wanted to tell me about was the day her son was killed by law enforcement. She told me about that, but I said, back up to Scott's point. How did you get to that day? Right? What happened in the months and years before that final day where you actually lost your son? And nobody had asked her that. And she told me the story, and as she told the story, it was so obvious that there were so many points of failure where we could have stepped in and we could have saved him long before the law enforcement was called on the day he died. And so that became my mission. How do we get her the support she needs as her son is suffering in crisis before he's in such shape? And we are in the community. Our job is to represent those people, to listen to their stories, and then to figure out how to change the system to work for them. So I think that makes us well poised to do it. But then in order to do that, you have to do the legislating. But then you can't just get the governor's signature and walk away, right? That's the beginning. When the governor signs the bill, as far as I'm concerned, that's day one. Then the job is to make sure the law does what that community member needs the law to do. And what we were talking about at our retreat is you need to do that as a legislator, your office needs to do that, but you can also write it into the bill, right? 988 has the 5-year implementation program. I wrote myself into the bill. I sat on that board with Health and Human Services, with Tara, to make sure that it was doing what we envisioned and what my community needed it to do. We've made it through that first year, but that's only year one. I'm going nowhere, ladies, sorry. But that's the work that it takes, right? And I think that we need to be committed to that. And that's, I think, the legislature with the change in term limits. And I was one of the first classes that came in under the 12-year term limit. And I think that 12-year term limit is changing that because we're around longer to watch, to do the updated bills, to make sure implementation is happening. Our new oversight committee that is much more active in the Assembly is born out of those of us that have been around for 6 years that are like, I passed that law and it is not happening the way I wanted it to happen. And so I think that as long as we commit to that work, we're absolutely the ones to do it.
Yeah, I definitely think working together is so critically important as well. And the reality is that mental health issues do not discriminate. So yes, it does impact our unsheltered populations greatly, but it doesn't discriminate between gender or ethnicity or income or religious orientation or LGBT status or immigration status or it doesn't discriminate. We're all impacted by mental health. And there's so many holes in the system for people to get the care that they need. After my husband died, my son was in college, and his university failed him. They failed our family. They did not provide any support, and he was having to withdraw from school because he just could not manage his, mental health, and he was just very distraught. And I was told by the school that we were 4 days late in requesting a refund for the quarter. And I said, well, we didn't plan my husband's suicide, so it happened. But there was no empathy. There was no willingness to work with us. And I feel like that's the start of his spiraling, because he's about to turn 30, and he is still not getting the help that he needs to live his best life. And no matter how much I do to connect him and to get him into counseling or to get him into a program, he doesn't show up. He won't go. I'm sure all of you have experienced these kinds of things in your life as well, where patients don't show up. They're not ready and willing to get the care they need to be able to live their best life. So we need to be working at every single level of the spectrum, and it really can't come from me anymore telling him what I think he should be doing, because I'm just not getting through to him. So, I've I tried to call 988 one time, and I ended up getting, it was a mobile mental health situation, and I ended up getting 6 cops with guns and bulletproof vests at my home. And that diffused the situation. They were amazing and wonderful. I think they get 8 hours of training on mental health issues. Not quite completely qualified to deal with the situation. And what I really wanted was the follow-up. I wanted someone to come out, see him in distress, and understand that this is somebody who needs follow-up care, and it didn't happen. So, we're continuing to try to work through it, but there's so many places where we need to provide assistance to people. And I've done a couple bills. I mean, I passed AB 1029 last year, which enacted the Psychiatric Advance Directive. So that would be a tool that people can use to indicate we have our health directives that we can say what kind of health care we want. So we're going to now be able to talk about what kind of mental health care we would want if we were to have a crisis. And I was honored last year to carry the bill AB 1907 on behalf of the Steinberg Institute that ensured that the mental health data is integrated into our child welfare system's outcomes dashboard. Because data drives decisions, and it's so critically important that we have the good data so then we can plan the policies and the programs that are needed around it.
So every Tuesday, if I remember it, the legislature, its houses, and its parties meet in caucus. Still Tuesday. And I remember it was always a good lunch. That's what I remember. Yeah. It's one good, not the same. How often does the issue of improving the behavioral health system come up in the caucus-wide discussions of your colleagues? I don't know, it wasn't on
Not as often as it should.
It wasn't on my script here, but I just thought it was
Not as often
an
as it
interesting
should.
question.
And I have asked for a select committee on California's mental health crisis. And I'm hoping to have a series of hearings this year, and we'll be talking more to my colleagues about getting their involvement and their feedback, because again, it takes all of us to be able to, navigate through this journey to improve our mental health system in California.
Yes.
I was going to give you a shout out, Scott. So it doesn't come up very often. And you can imagine that's in part, and I'm sure it was the same when you were there, you're dealing with the latest crisis. Yeah. Right now it's the wildfires. Before that it was the insurance cancellations, right? So we are dealing with the thing that is right in front of us that we have to deal with at the moment, and there is always something, sadly. And this tends to be the thing that is constant, right? It's the constant buzz underneath it all. And so we need it to rise to that level. But, the select committee is important. But the other thing that I think is really important is Senator Wiener's bicameral mental health caucus, which does allow us to get together both sides of the House, bipartisan, and talk about mental health and how we're going to work together to move it forward. And that's been incredibly good.
Yeah, we do. It definitely does get discussed, not always as a full caucus. And I will just say, and the Assembly member just mentioned all the special sessions that the governor calls us into on various, significant issues. Since I've been here, we've never had one on housing. We've never had one on mental health. We've never had one on homelessness. And one of the frustrations with legislating is it can be very piecemeal, right? It's one at a time, and you can do a bill that's big. It would be great to just solve it, just to do it all in one fell swoop, and one thing I do want to say before, the reason why I was a little late today is we had a Senate public safety joint hearing of Public Safety Committee and the Budget Subcommittee on Public Safety around Prop 36 implementation. It's actually, I did not support Prop 36. I stand by that position, but the voters spoke. But what I pointed out in the hearing, because we know that the cops and DAs are going to come and want all sorts of money from the state, in their campaign for Prop 36, they were very, very clear. It's not about incarceration. It's about treatment. And so, okay, well, you said it. You spent all that money on your ad saying it. It is an opportunity for us to start really helping the counties build out stronger mental health, behavioral health infrastructure.
And just one more thing. So we did have a caucus meeting on Prop 1. I remember that one. And that was really helpful in talking points around that. But I also want to mention every September or August, I will do a resolution recognizing Suicide Prevention Awareness Month in September. And the first time I did that and I stood up to speak, I just lost it. It was very hard to get through my comments I wanted to make about suicide and sharing my story. But I persevered, I got through it, and I noticed there was the place was silent, and it's rare to have the floor be silent like that. And a Republican member put his mic up and shared for the first time publicly his own story of suicide ideation that he had coming back from the war. And I think that day there was just not a dry eye in the floor in the House. I mean, everybody was really feeling it, and so many comments were made. I mean, RBK does amazing pulling her mic up and sharing stories and the work she's done in this field as well. And it was really just a very powerful day. And I think we just need more of that. And being in this position and having that platform has been extremely empowering.
And can I just say, for Assemblymember Pellerin, the bravery that you have to get up in front of this body and the world and tell that story, and the pain that we can see in you as you do it is going to save lives, but it is remarkable.
Well, so I think we've got about 20 minutes left in this panel. I want to make sure that we have some audience participation here, and so I'll leave some time for questions. I want to ask about data. So yesterday, the administration, I think in a very positive move, put forward this new data tool that measures the county progress towards, and the city progress towards getting people off the streets. It lists the number of full-service partnerships. It doesn't say how many of those so-called FSP wraparound services are actually for people who have been unsheltered. It doesn't quite make that connection. And I want you to comment a little bit about the drive for more coherent data. Again, prior to the Newsom administration here, I would say charitably that the state did very little in terms of trying to create the hardware so that counties could input data in a way that would be easily understood and transparent. And so now we have Prop 1, which requires a statewide outcome-based data system. But what's really happening here? And can we expect a day, sooner than later, where the public and policymakers will really be able to know what interventions are working and what interventions are not working?
I dream of that day.
And what do we do to further that?
It's so fascinating. I'm not on the budget committee and have never been on the budget committee, but as a fellow nerd, I often watch the budget committee. And I'm always fascinated, no disrespect to the administration, that when asked, how did this go? The answer is almost always, we got the money out the door. And you're like, and then what happened? Oh, well, the money went out. It went out on time. It went out on... I'm like, that is not the question. The question is what happened after the money landed in the hands of the people who were supposed to make a difference. What were the outcomes? I mean, I come out of the private sector, and of course you're looking at the outcomes of the money you're spending. And we don't do that enough in government. And I do think that the dashboards across many of the agencies that have happened under the Newsom administration are a real step in that direction. But I think it's also what the voters are demanding. I mean, we're seeing the dismantling of the federal government right now because people don't believe government is effective. And so it's our job to show them it's effective, right? If we're not doing that, that's our failure. And so I do think that data is so critical to get the people who give us their hard-earned dollars every single day to understand the value, the benefit that they get from it. It's why we could pass AB 988 in a historic surplus with bipartisan, overwhelming support. Because we proved we were locking that money down and it was going to be used for something that people believed would save lives and do good. And when they see that and they believe it, they're willing to invest in it. And so I think we have to do it. And I think the moves the Newsom administration is doing are great, but we have to push harder to get that information in budget hearings and to make sure we're getting the answers of who's being helped. And there's hesitation from the locals. Often when we ask those questions, they don't like it. They believe they're doing a good job. In a lot of cases they are, and they don't want to have to explain themselves to us. But at the end of the day, if we're giving them dollars, we need to hold them accountable.
Data? Senator Wiener? Data and mental health, behavioral health.
Yeah, it's interesting. Our last governor, Governor Brown, who was a fantastic governor and for so many reasons, we had there was disagreements between the legislature and the governor, as there always are, but there were some big ones there, and one of them was he was not a big fan of bills requiring more data collection, I think because he probably viewed it as that was going to be a precursor to asking for money, because once you collect data, you can ask for money. And so he sometimes would veto these bills, and data collection bills always have costs, so they sometimes get tripped up in the Appropriations Committee. We need better, not just collecting data, but making it super easy for the public to see it and understand it, and that it should be an easy thing, and it's not. I will also say the legislature needs to do more oversight. We never do enough oversight, and there are a lot of institutional barriers to effective oversight in the legislature.
Although I love the auditor. The auditor is one of my favorite people.
I want to move a little bit quickly now. What is the definition of success? And I ask the question in this regard. You could point to the last 6 years or 10 years, and you could produce data that shows tens of thousands of people are off the streets because of some of these investments we've talked about here today. You can point to model programs that actually help rehabilitate people who have left state prison or county jail. There is so much success out there, and yet the problems seem to be growing larger. And some might argue, if I were a county or even a private health plan, that we're not the cause of the mental health crisis here. It keeps getting larger. And we don't have the resources, no matter how much you put into this, to help everybody with the traditional way that the system would help people. So it begs it begs several questions. Is that a fair defense? And secondly, do we need to look at new ways to help people who are suffering? Clubhouses, Ken Zimmerman sitting out there, who's championed that, more communal-based settings for people who are suffering and need support. Are we missing something in trying to feed and improve the current system, as opposed to saying there has to be other ways to help the human condition?
I mean, I think the answer is both, and for the pushback, like, there's more need and we can't pay for it. I mean, there are cancer rates that are going up. There's a lot of health issues that get maybe better or worse over time, and the system has to be able to deal with that at a system level. But absolutely, we in addition to shoring up access to traditional care for behavioral health, we should always be looking at new models. I know when Senator Jim Bell was here, who was a mental health, behavioral health champion, he was always pushing for broader access to peer support. And we were able to, at one point in the budget, we have the warm line in San Francisco, where people could just call and talk to someone with lived experience. And so it should be a whole spectrum. Not everything requires formal care, and we're not always good about acknowledging these other models that can be really helpful to people.
I think also telehealth has been really helpful as well. My daughter and I actually do counseling on Zoom now with a counselor who doesn't even live in California, but she's licensed here. That has opened up accessibility because she lives in Canada and I'm here. And so, having that availability. And in my district, I've been able to tour and see a lot of the wellness centers at schools, which I think are really helping to remove the stigma in a school environment that it's okay to not be okay, and to take time to focus on your own mental health and well-being. So I think we're making a lot of progress, but there's still so much more that we need to do in this space.
Yeah, the Steinberg Institute has taught me their saying, right? Someone to call, someone to come, somewhere to go. And I think that's also critical.
Say that again.
I'm well trained, Tara. Are you proud of me? Someone to call somewhere, someone to come, and somewhere to go. And I think that that is the spectrum that we talk about a lot. And last year, I actually called Tara and I said, what about before you need to call someone? You know, I think that that is where we are failing. And it's, you know, as you were talking, Mayor, I was thinking, I'm going to call the insurance companies and see if they'll co-sponsor my social media bills. That'll save them some clients. But, you know, I do think that we need to think about, I'll say you thought of it, but you didn't.
I love it. Tilted a windmill. I love it. Tilted in many.
But, you know, that is, you know, and one of the things that I achieved last year in partnership with the administration was putting in into the budget last year some language that really talked about the wellness coaches and what kind of training they should have and what they should be providing in schools, and that it should be science-based. Because we do have these great systems, but we realized when we set it up, we hadn't put those standards in place such that across California we knew that they would be effective for every student. And that was something that we jointly decided we wanted to put in the budget and was achieved last year with very little controversy, and nobody talked about it. But that was in part because I started to think, how do we get them to not need to call? How do we reduce the number of kids that are getting to the point that they need 988? And so I do think as we talk about the spectrum, and I think that, you know, the folks at the Department of Health and Human Services do this beautifully, it has to start there. It has to start before someone has ever had a behavioral health moment of need even, right? You know, I mean, the ideal situation is that we start to see less of a crisis. And I will say that for me, I love data, I'm a nerd, but for me, success, I always say the best part of my town halls is the 10 minutes before it starts and the 10 minutes after it ends, and what people come up and talk to me about. What are they thinking about that I'm not talking about? And right now, it is 3 things. And one of those things is the behavioral health crisis. And I will feel like we succeeded when that drops off the list.
May it be so. Yes. So my last question, do we have a little time? I mean, I think we could keep going all day on this. This is great. I want to talk another maybe overused term, but one that I always think about, and that is fragmentation within the system. You know, a person who's suffering doesn't care whether they have X coverage or Y coverage or no coverage, or whether it's BHSA or CalAIM or private insurance that gets them the help that they need. We have so many different systems of mental health care, behavioral health care in this society. Do you have any big picture thoughts about how we bring it all under one roof in a way that allows the individual, regardless of their card or no card, they can get in and see somebody and get the help that they need?
You're dreaming big.
That would be success too. That would be
I know,
amazing. Just
right?
having a one-stop shop where you can go and get the help you need for whatever ails you. That would be a dream.
And I do think that, you know, the counties, and many of them are trying to do this, right? I mean, they've always been really focused on our most needy individuals, but they are starting to realize that even people who have insurance right now don't have access into behavioral health care. There are not enough people in the system to support them. And so the counties are actually becoming a much more central point of contact for people who I don't think we'd ever envisioned being the users of county resources. And I think it hasn't always been smooth, but they're leaning into that and leaning into the idea that they can provide support and they can get the insurance pay. Like, why is it there has to be this model where it is also fragmented? But it's hard, and they have too many people to support, and so that's why many of the biggest bills you've heard about are the ones that are funding all of this, because that is the key, is that we have amazing people. And look at this room. This is amazing. We have amazing people in the world that want to do this work. And so I always think the most important thing we do is we fund and build the systems that support the amazing people in California that care deeply every single day for the people who are suffering. And so to the extent that we can support that, the better.
Let's open it up, please. We got a mic over here, I think. No, it's okay. Go. Okay.
Hello. Linda Mims from San Diego, and I'm an advocate, and I represent families all over the state. I can say that, yes. And I just have a couple comments. One is, when you're measuring metrics, you really need to figure out what is the one outcome that is the most important all across the state for people that are suffering from psychotic illnesses like schizophrenia, with no treatment. And I would say that if you ask any parent or any doctor, whatever, the number one outcome we want to see is we want to see that individual in recovery, no matter what that looks like. Some people can't have a robust recovery and other people can. But these are treatable illnesses, and we're denying the treatment. And a big part of that is our laws, because we don't recognize these illnesses as brain diseases. So, as Mr. Steinberg, Mayor Steinberg was saying, so for instance, if we want to get early treatment before crisis occurs, we can't, because say our individual is over 18 and they're in a psychotic crisis and they do not recognize they're sick, they have anosognosia. Well, how in the heck are we supposed to get treatment when we try in our county? We call all the people that we think would have the power to get our child treatment, and they're saying, well, he's not gravely disabled even if he's lying on the ground by a trash can with sores all over his body, but if he lifts himself up and takes trash out and eats, food, then he's not gravely disabled. Well, now we have SB 43. And we worked really hard, advocates all across the state, to get that passed. And I'm very concerned because I used to work for a senator, and I know that laws with every good intention, if they're not implemented correctly, then they're not going to work. So that's my 2 cents.
Good point. No, thank you so much for sharing. It's all about implementation.
But I'll add that your advocacy could not have been more critical to the success of that bill, because I can't tell you how many people came into my office telling me not to vote for it. And my follow-up question to them was, what's your lived experience? Why are you telling me this? And the people who are against it almost never had lived experience. And every single person who walked into my office and advocated for it did. And that was game-changing for me. I believe the people who've lived it.
And I also, I'm a big advocate for screening as well, and I think we need to have more mental health screenings to be able to identify issues early on, especially with our littles, our 2, 3, and 4-year-olds that are presenting with mental health issues.
And I will, specifically for SB 43 implementation, I totally agree with you, and I have seen over the years, because we went through decades of hostility towards conservatorships, because people, the reaction against the state hospitals, which of course were a problem, but we went so far in the other direction, and there was this institutional hostility. So I've seen it even in San Francisco, just as we were passing some conservatorship laws leading up to 43, the different agencies that were involved in interpreting it and implementing it, et cetera, they would look for any reason to say, no, you can't do this. They take the most conservative interpretation of everything, and that is a major institutional problem at the local level that we have to change.
Ken?
Thank you. It's just a wonderful panel. I'm Ken Zimmerman, proud member of the Steinberg board. I'm also the CEO of Fountain House, a national mental health organization that really focuses on recovery and thriving of people with the most serious mental illnesses, but starts with the premise that community is a therapeutic intervention and that the voices of those people themselves are absolutely critical in making a difference. So one comment and I should say, very excited to be actively now participating in Los Angeles and in conjunction with creating a whole new ecosystem of these clubhouses with great support from the county and others. One observation, one question. I do think this issue of data needs to be connected to what the outcomes are that we want. And we start with the premise and a belief that if you make thriving, you make overcoming loneliness and overcoming isolation key elements of what it is that we seek to achieve, very different things start to emerge. And I would love to hear more on that front. In addition, I suspect I speak for many that there was an election in November that most of us are aware of. The changes in the federal picture right now are ones that we're all aware are going to affect all of us. And I'm interested, as you think about it from the state's perspective, what are the things that need to be done and how you're thinking about, one, getting ahead of much of what I think for most of us could be a very dire picture in terms of the innovations and the steps that we're taking to try to advance so much of what was articulated before. Thank you.
I mean, it's an incredibly important point. In fact, today, the House of Representatives is scheduled to, I don't know what's happening, they're 3 hours ahead, to vote on the first step towards taking a wrecking ball to Medicaid. And we know 70 million Americans, 16 million Californians rely on Medicaid. And even though Trump runs around saying, we're not going to touch Medicaid, he's a liar. I'm sorry, I'm just going to say it. Because as he's saying that, Mike Johnson, they want to give these massive tax cuts to rich people and corporations and pay for it by getting rid of quote-unquote fraud, waste, and abuse in Medicaid, meaning cutting Medicaid benefits, and SNAP, and all the other things that people need. And if that happens, if they're successful, if we don't have at least a handful of Republicans in Congress who have the backbone to say, no, I'm not going to screw over my constituents, that is going to, the effect on our budget, and I say this as the budget chair with trepidation, is going to be profound, because we cannot backfill. If there's an avalanche of cuts to education, healthcare, et cetera, there are limits to our ability to backfill it. We have to balance our budget.
Thank you. Next, on that cheery note, go ahead.
Sorry.
Somebody asked something that can end us on an uplifting note.
No, I got one more point I want to make, but I want to get more questions. But it's true. I mean, we can't ignore it. And maybe
right.
there'll be a few brave folks that will prevent that from happening. Go
We
ahead.
have time for one more question and then closing remarks.
Got 5 minutes. Go ahead, Leandra.
Okay, I'll take less than that. Hey, everyone. Dr. Leandra Clark-Harvey from the California Behavioral Health Association. Thank you for the shout-out to the work that you've done with our founder, Rusty, over the years. My question is riding on the answer you just provided, Senator Wiener, around what can we do to all of us, many of us belong to behavioral health advocacy groups. We're trying to get laws changed. You all are at the front lines trying to do that as well. Our members are in the front lines, in the trenches, providing services. Considering all of that and the budget constraints and the political reality, it's great to have vision, right? That's what we're here to talk about, and we appreciate that and stand beside that and partner. And what are in your opinion, what are the low-hanging fruit opportunities that we have right now to make change? Where can we immediately act?
I think that this is the most bipartisan issue I have ever worked on in the legislature, and I work almost exclusively in a bipartisan way. I represent a purple district, and it doesn't discriminate. And so I actually think that the people in this room from communities, and I know there are people in this room from communities represented by Republican congressmen in California, you have the ability to talk to Republican voters in those districts who agree with you. They want these services. And if you saw videos from some of the Central Valley town halls that have been happening recently on the Medicaid cuts, Valadeo is maybe not going to vote for it because his constituents are screaming at him. And he knows it makes him vulnerable. And you have the ability to organize people in those districts to protect those Medicaid dollars. I actually believe we can do it here in California.
And I can't stress enough the importance of just that community groundswell and getting that feedback. And all the work that you are doing in your communities really gives me hope. All of our nonprofit groups. I'm a member of NAMI, the National Alliance on Mental Illness. The work they're doing around peer-to-peer and family-to-family training. I mean, it's just, these programs are vital, and it just gives me hope. So thank you for everything you guys are all doing.
One more. Go. Get that mic over to you quickly.
She's running.
Thank you, Carmen.
Hi, my name is Carmelita Pinedo, and I've been a caregiver for 38 years in the industry of caring mentally disabled clients. And when Reagan released and closed the mental institution, they I'm a little bit nervous. They institutionalize it. The care home industry started, and during that time, there were a lot of caregivers taking care of this condition of mental illness. But during the time wherein it progresses, as the economy is more like inflation and everything, it didn't caught up with the caregivers. And if you do the math, the caregivers are only being given $1,000 a month to take care of the same services like more of the hospital, cooking, taking care of them, bringing them to the doctor's appointment. We are expected to do a lot services, but the compensation is so little. So a lot of these caregivers gave up the job, especially those who are only licensed for 6 beds. They go from, if they're not allowed to leave the clients and they don't have anybody to take care of them. So if you go to church, you go with the clients. And if you wanted to go shopping, you go with the clients. So a lot of their caregivers, with all their dedication, opted to close the facilities. So you see a lot of homeless down the street because in a structured environment and with the caregivers giving all their services, so where do you expect the homeless people and the mental condition will go? They go to the street.
They get question? Did you have a question for the panel members?
The thing that I wanted to happen is that if only because if you are funding the hospital, one client there is being given about $20,000, $15,000 to $20,000 per month, as opposed to the caregiver when they release the client $1,000, and then they close the facilities. They made the population of the mental health in Sacramento to 50%. So what I wanted to happen is that if you will compensate the caregivers, giving them enough accordingly, there won't be any mentally disabled on the street.
Maybe that's a good segue to the last word about workforce and how we support and build the workforce around this effort. Go ahead, last word.
We have to pay them enough and reimburse enough.
Yeah, and I would say also just create pathways for this to be a good living wage job and for Californians to see it as an option and to have more diverse community members see this as a pathway, because people need caregivers and people who treat them that look like them and understand their lived experience. And so I think we have a lot of work to do, because that is not currently our situation here in California, and we've been trying to do it, but we can continue to do better, because we also need to make sure that AI is not filling those gaps.
Yes. And just those caregivers are the warriors out there who are really in battle against the mental health crisis we have, and we absolutely need to pay them more, give them time off to deal with their own mental health and well-being, and take care of their families as well.
And guys, is that we need to stop with the jurisdictional turf wars among the mental health professions. It is toxic, and I had in a bill just a little thing asking for a study of whether make sure people can practice up to their licenses and whether we need any adjustments, and it ended up just collapsing because of the just toxicity of these turf battles within the mental health professional world.
Well, I don't know about you, but I see 3 dedicated public officials who are thinking about this, acting upon it, and doing good and great work. And really appreciate all 3 of you. Assembly members, Senator, thank you.
Thank you, Darrell, for your partnership.